So today we can say that we are not seeing any massive impacts. Sorry, take my sunglasses off. We are not seeing any massive impacts on our hospitals, which is really good news today, but we are monitoring this very closely. I just want to reassure Queenslanders that although we are seeing increase of cases as we have expected, we've been planning for this, we are not seeing the impacts on our hospital system to date. But I want to assure every Queenslander that we are monitoring this very, very carefully. I want to make sure that Queenslanders get their boosters. We know that that booster is an added protection, and I also want to see our children being able to get that first dose before they go back to school. So I'll have more to say about children in a moment. So at the moment, only 4 people are in hospital who are receiving care for COVID-related symptoms, and our Chief Health Officer will talk a little bit more about that in a moment. Yesterday, 24,515 tests were administered by Queensland Health, and of course we haven't got any increases yet on our vaccination numbers across the nation because I don't think the Commonwealth provided those statistics yesterday. So with and we have 784 new cases, so we are expecting those case numbers to increase, but like I said, we are monitoring it very closely. Now, I know there's a lot of elderly people out there across Queensland that are concerned as well. Can I please ask you, when you get the opportunity and you're due to get your booster, to please book in and get that booster shot. We know that's really, really important. Also too, monitor how much you need to go into crowds, but please everyone, wear this mask. This is so important. Going into crowded areas, all of our retail staff must be wearing this, and also when you go into shops, when you go into cafes and restaurants, except when you're eating and drinking, please remember this mask is so important during this particular time. Now, I know there are a lot of parents who are also asking when their children can get vaccinated. So I'm very pleased to say, and of course, people remember that this was an issue I raised up front many months ago, and at the time I was shouted down, but this is really important now because we know this pandemic can actually have impacts on the unvaccinated, mild symptoms in children, but we do want to make sure that our children are protected. So those children who are under the age of 12, so 5 to 11, from today, Queensland Health will start accepting your bookings for children. So they will be able to start getting their vaccinations from January the 10th. And of course, children will also be able to go to the GPs and the pharmacies as well to get their vaccines. It's important, let's wait that boat goes past, jet skis. It's important that we get as many children vaccinated as we can before school goes back. And children get a smaller dose, of course, and this has been tested, but it is up to you to decide whether or not your children get vaccinated. But the more of our community that are vaccinated, the better. But the Chief Health Officer will talk to you about that a little bit more. And finally, can I just say, look, I do understand that there have been some queues at some of our testing clinics. We had a good discussion about this morning with a range of health officials. We are increasing capacity at Metro North, Metro South, Gold Coast over the next 24 to 48 hours, and Cairns. So let me just say those again: Metro North, Metro South, Gold Coast and Cairns. So I'll hand over to the Chief Health Officer. Thanks.
Thank you very much, Premier. So today in Queensland we have 784 new cases, and again the numbers of significantly unwell patients in hospital with COVID-19 remains low, with only 4 reported. We do have one man who is moderately to severely unwell, an 85-year-old man with other medical conditions. So he is one moderately to severely unwell, although not in intensive care and not on a ventilator. I guess it's given the significant number of cases that are active. We have 3,621 cases currently active. The numbers of patients that are in hospital sick suggests strongly that these vaccines are working. It is quite striking. And again, I mentioned yesterday, the patients we're seeing are still on the young side. We haven't seen a lot of patients in the older age groups, but we've seen some. So the vaccines appear to be working. But it is critical that people get their third dose of the vaccine when it's available to them, particularly older people and people who may have some impairment of their immunity. So there's been a total of 5,798 cases since the beginning of the pandemic. There were 24,515 tests performed yesterday. Case locations, again, I won't go through them. They're right across Queensland. You can assume that wherever you live in Queensland, you have the potential now to be exposed to this virus, and you should be living your life as if that is the case, wearing a mask whenever you're indoors or close to other people. Omicron remains dominant in Queensland, about the same sort of proportion at 75%. We're increasing the number of people we're caring for in their homes or in other designated locations. So we have 900 cases who are being managed outside hospital. The number of cases in hospital is down to 68 at the moment, recalling that most of these people are not there because of symptoms related to COVID. And as the Premier mentioned, the vaccination data was not released by the Commonwealth in the last 24 hours.